Hello, how are you? I'm student Dr. Loftus. This is student Dr. Garrison, student Dr. Alvarado, and student Dr. Garcia. Give me 1 second. Wash my hands. Okay, and your name?
Zion.
Zion? Okay, your last name?
Alexander.
Alexander? Okay, and do you mind if I sit down, Zion? Okay. And how old are you, Zion?
28.
28? Okay. And what brought you here today?
I have this pounding headache that just won't go away.
A pounding headache. Okay, and when did your headache start?
I'm not really sure.
You're not sure? Okay. Has it been like for a day, weeks, months?
Weeks.
Weeks. Okay. And is it any time of the day that it feels better?
During the weekend?
Weekends? Okay. And has it been constant? Does it come and go?
Constant.
Constant. Now, I know you said it's constant, but sometimes is it less intense and more intense than it is at other times? Or is it always the same?
It's the same.
Okay. And is there anything that makes the headache worse?
Sorry, can you repeat that?
Anything that makes the headache worse?
Not really.
Okay. Anything make it better? Like, have you taken like Tylenol, aspirin, Motrin? Okay. Okay, and with this headache, have you been experiencing dizziness?
No.
Okay. Any blurred vision?
No.
Okay. Any nausea?
No.
Do light or sound make it better or worse?
Sorry, can you repeat that again?
Light or sound, does it make it better or worse?
No.
No? Okay. And so have you seen anyone about this headache before in the past? You said it's been going on for how long now?
Weeks?
Weeks? Okay, and have you seen anyone for it?
No.
No? Okay. And when was the last time you've had a checkup? Just a normal checkup, annual?
It's just gonna say, 4 years.
4 years ago? Okay. Any reasons why you haven't gone to get a checkup? You just didn't feel like you needed one? Okay. Okay, and so now I'm going to ask you about your past medical history to see if you have any of these illnesses. So, have you been diagnosed with diabetes, or has your sugar been high on any prior doctor visits? Okay, and what about your blood pressure? Has your blood pressure been high? Okay. Do you have any histories of heart disease?
No.
No. Asthma? Okay. Have you had any stomach problems?
No.
Okay. Does your stomach get upset after you eat? Okay. And do you take any medications on a daily basis? It could be like over the counter, like I said, Motrin, maybe Claritin, Tylenol. Okay. And do you know if you have any allergies to any medications? No allergies. Okay. And can you give me a little insight about your family history? Your mother or father, do either of them have any medical problems such as diabetes, hypertension, heart disease, anxiety, depression?
Sorry, can you repeat that?
Your family, your mother or your father, do either of them have any, do they have diabetes, hypertension, heart disease, anxiety, depression?
I don't know.
No? Okay. What about your siblings? Do you have any brothers or sisters?
Just one sister.
Okay, and what about your sister? Does she suffer from any medical problems such as diabetes, hypertension?
Not that I know of.
And I'm gonna ask you about your living situation. Is that fine?
My what?
Living situation? Okay. So who do you live with?
By myself.
Okay, by yourself. Okay. And are you sexually active?
Yes.
Okay. And do you use protection?
Yes.
Okay. And how many partners are you having right now?
One.
Okay. Okay, and so can you let me know a little bit about your work experience, educational experience? So are you currently working?
Yes.
Okay. And what do you do?
I'm a paralegal.
Paralegal? Okay. Do you like it?
Yes.
Okay. Did you go to like a post-high school, like do you have any post-high school education such as community college, university, or did you get a certification to work in this field?
Can you repeat that again?
So have you had any further education than high school? So do you have a certification? Have you gone to get your associate's degree, university level education?
Just associates.
Okay, associates. And where did you get that from?
STC.
Okay. Let's see. And let's see. How about your diet? Do you have a good diet? Do you eat vegetables? Get enough protein, carbs?
I tried.
You try? Yeah, we all try. Okay. Do you exercise regularly?
I tried some.
Okay. And about how many times per week do you say?
I would say like 2 per week.
Okay. Okay, and the last two questions for this section. Okay, so do you know if your vaccinations are up to date?
I'm not sure.
You're not sure, okay. Do you remember the last time you were vaccinated and what you were vaccinated for?
No.
Okay. And do you smoke or use tobacco? Okay, what about drink? Drink alcohol?
On the weekends.
Weekends? Okay, and any drug use? No? Any drug use in the past? Okay. Okay, so Mr. Alexander, you basically said that you were here today because you've been having a headache for a few weeks. It's been pounding, constant. You said it's kind of better on the weekends. There's nothing that makes it better or worse. You haven't been experiencing any worsening of the symptoms with light or sound. You said no dizziness. You said no nausea, correct?
Mm-hmm.
Okay, so now I'm going to ask you a series of questions. You can just basically say yes or no to them. It's going to go, it's called a review of systems. It's going to start from the head to the toe. And just let me know now or with the headache, have you experienced any of these symptoms? So have you experienced any fever or chills?
No.
Okay. Have you had any ear pain or ear loss?
No.
Hearing loss, excuse me.
No.
No, okay. Any mouth pain, sore throat, dental pain?
No.
Okay. What about blurred vision or loss of vision?
Well, I'm wearing glasses. So
Okay. And when was the last time that you've seen an optometrist?
like 3 years ago.
3 years ago. Okay. Okay, so have you had any abdominal pain? Nausea, vomiting, diarrhea? Okay. Any leg pain? Swelling in your legs? Okay. Chest pain? Feeling like your heart is racing sometimes? Okay. Rash, sweating? Okay. Cough, difficulty breathing? Okie dokie. And so now I'm gonna, if you don't mind, I have another test that I want to do, and it's called mental status exam. Do you mind if we go through these questions? Okay. And basically what this is for is just to test your awareness, you know, see if you have any difficulty with your memory. You know, you said you had a headache. Just want to make sure everything's neurologically intact. Okay, so can you tell me what year it is?
2016.
Okay, and what season? Yeah, I think it's always summer in Texas, actually. I don't think we have any other season. The dates,
August 22nd.
okay. And the day of the week,
Monday.
Monday? Okay. So now I'm going to say 3 words and I want you to repeat these 3 words. And then in 5 minutes, I'm gonna ask you to repeat these words again. Okay, so keep them in your working memory. So, ball, tree, and dog. You repeat them for me?
Ball, tree, and dog.
Okay. Okay, so now I'm gonna say a word. I want you to say the word. I want you to spell it forwards and backwards. Okay? World.
World.
Mhm.
There are 5 minutes remaining in the encounter.
WORLD.
Okay, and can you spell it backwards?
TLROW.
Okie dokie. You're better than me. I was thinking about it in my head and I actually was like, wait a minute, how do you spell this? Okay, so now I'm gonna say a number, which is gonna be 100, and I want you to count backwards by 7 from 100. So just subtract 7 from 100 and then subtract 7 from that and so forth. Okay, so 100 and subtract 7.
93.
Okay, good. And now subtract 7 from 93.
86.
Okay. Now subtract 7 from 86.
79.
All right. Good job. Now we're gonna go back to the 3 words I told you to remember to repeat to me. Can you repeat those 3 words?
Ball, tree, and dog.
Good job. All right. And so I'm gonna hold out an object. I want you to tell me what it is, okay?
A pen.
Okay, and
ID.
okay. Don't look at that picture, it's pretty bad. Okay, and now I'm gonna ask, so that's the end of our mental status exam. So now I'm gonna just ask you some questions about yourself. So, what do you like to do for fun?
I hang out with my friends.
Hang out with your friends? Okay. And have you still been having enjoyment in doing this? So do you still do this every day? I mean, what, once a week or so?
On the weekends.
On the weekends? And do you still find enjoyment in this activity? Okay. And has there been any kind of trauma in your life that you've been experiencing? Like stress?
No.
No? Not at work? Everything's good at work? Could be a pretty intense field, so, but everything's good?
Yeah, it's okay.
Okay, and do you have a close relationship with your family?
Not really.
Oh, why not? Okay. And, I think those are all the questions that I have for you right now. Do you have any questions for me? Any concerns, other than the fact that you have a headache? No? Okay, well, we're gonna do our best to try to figure out what's going on. It was nice meeting you, Mr. Alexander. Thank you for allowing us to have this interview.